Guys, today I will discuss our first lesson of radiography. That question answer. The summary of the patient consent can be verbal, written, or implied. A valid consent, the valid patient consent include four conditions. Next is the hospital information system must be confidential in the compliance with the Health Insurance Portability and Accountability Act 1996 regulations. The AHA patient bills right detail to the specific area. Patients right that the healthcare professionals is obligated to the respect. The HAS has replaced the patient's bill or right with the six-part patient care partnership. Next is an advanced healthcare directive or living will name the individual authorized to make all healthcare decisions and can be include specific regarding DNR and DNIR and other and life decision. The SRT practice standards identify level of knowledge and skill required to professional radiographer. Next, the radiographic examination may be requested by the physicians or the physician assistant. Next, the radiographer should examine the requisition carefully prior to bring the patient to the radiography room. Most healthcare facility require examination. Most healthcare facility. Next is okay. Then. Where I raise the next is radiographer should be carefully prior. The most health next is most healthcare facility required that examination requested include the patient's diagnostic information and any infection control or isolation information. Next, the civil justice or is taught. A tort can be intentional or negligence. The negligence next is the negligence. The litigation in radiology most frequently involve the injury from the fall, positioning injuries, pregnancy errors, or the delay in diagnosis. The RT standards of ethics has two parts: the code of ethics and rule of ethics. The code of next is the code of ethics. Detailed guideline radiographer professional conduct aspiration. The rule of ethics are mandatory and enforceable. The next question for there is the question for is the RT document. Next question, chapter of the quiz questioning. The RT documents that define the radiographer role is the standard of ethics, practice ethics, standard of care, and legal standard. The SRT document define the radiographer role is the standard ethics. The answer for this one. The next is the the le, leg, the legislations that guarantee confidential of the all patient is the confidential is HIPAA HIPPAA. Second one B. Answer of this question is B. The next is the violation the RRT rule of ethics. The violation of RRT rule of ethics accepting responsibility to perform function outside of the scope of practice and failure to obtain patient information to radiologist, failure to knowingly require knowledge peers. The violation is the RRT ethics include. The answer is the first one A. The accepting responsibility of responsibility to perform a function outside of the scope practice. Next question is the patient threat to do harm refer to as the threat to do harm. is referred to as the assault. Threat, assault. Threat to do harm, assault. The next question: radiographer who disclose confidential information authority individual may be found liable for. The radiographer who disclose the confidential information to unauthorized individual may be found liable for defamation. The answer is the D. Fifth answer is D. I'll just make sure the fifth answer will be D. Yeah, fifth answer is the D. The next question is sixth one. The patient right include the following: a right to refuse treatment, right to confidential, right to process one medical record, right to possess one medical record. I'm not sure about the third one, maybe first and second, I'm sure. So sixth one either B or either D. So we'll see. Yeah, sixth one is B. So next question is right to refuse treatment, right to confidential. This is both answer of the patient right include the following. Next question is the what organization has authorized to impose professional sanctions to radiographer, the ART or ASRT? I think so. ASRT is the organization. ASRT organization can sanction the radiographer. So next answer I will check it out. The seventh one, that one, right? Yeah, seventh one A. ARRT is the organization who can sanction the radiographer. The next question is an individual legal documents that name the person authorized to make all healthcare decisions. Should they be able to is called the individual legal documents name the person authorized to make all healthcare decisions. Should they be unable to is called living will, advance healthcare directive, and last will treatment. I think all of three should be answered because the advance healthcare directive may be answer, but first and three I am sure about this. So first and three, yeah, the D will be answer, I think so. Next we will check the eighth one. Eighth one is B, and answer is B means first and second. Last will of testament. This is not the answer. The individual legal document name the person. The person authorized make healthcare decision. So he can make the living will and advance healthcare directive. The next question is which of the following refer to patient right to privacy? Patient modesty must be preserved. Patient dignity must be respect. Right of privacy. Third one is the confidence. I'm sure third one. Dignity must be respect. Yeah, I think all of three should be there. Ninth one D. Yeah, of course. Ninth one is D, and tenth one is the patient. If the patient lack decision making capacity, right can be exercised on the behalf by designated surrogate, designated proxy. No one. Surrogated, I think so, or proxy. Both, I think. First one, second. Yeah, maybe C. Yeah, designated surrogate, designated proxy. If the patient is unable to make decision, then two of them will exercise behalf of this patient. So this is the answer. Thank you.